Decreased milk supply with hypoglycemic newborn. Hi everyone, my name is Tracy Sellinger and I'm currently enrolled in BCIT's NSPN 7155, the Breastfeeding Experience. The topic that I'm going to talk about is decreased milk supply with a hypoglycemic newborn. I'm going to apply the situated clinical decision-making framework within the context of breastfeeding. After working through this decision-making framework, I will identify 3 best practice measures to resolve this breastfeeding challenge. Decreased milk supply. Some mothers while breastfeeding may be faced with the challenge of decreased milk supply. Decreased milk supply is a situation where the mother does not produce enough milk to meet the needs of her infant. In the evidence-based research that I have done for this assignment, it is rare to have an actual problem with the mother's production of milk. It is mostly due to the delivery of milk. Maternal causes, prenatal, intrapartum, postpartum. Maternal causes of low milk supply can be organized in prenatal, intrapartum, and postpartum factors. Prenatal factors affecting low milk supply can be primary insufficiency due to insufficient growth and development of breasts, polycystic ovarian syndrome, which causes abnormal release of pituitary hormones, insufficient glandular tissue, breast surgery, especially reduction and sometimes augmentation, and hypothyroidism. Intrapartum factors affecting low milk supply can be due to epidural use and retained placental tissue, which may alter the normal hormonal shift. Postpartum factors affecting low milk supply can include Sheehan syndrome, anemia, inadequate hormone levels within the endocrine system, inverted nipples, lack of effective latch, delayed kangaroo and skin-to-skin care, infrequent feeding times, incomplete removal of milk, supplementing with formula and juice, use of accessories, maternal stress and fatigue, and lack of support. As you can see, most of these risk factors are issues in the postpartum period. These risk factors interfere with the supply and demand of breast milk, which will lead to decreased milk supply. Remember, less time at the breast equals decreased demand, which equals decreased output of breast milk. Neonatal causes. Neonatal causes of low milk supply are tongue-tied, has poor or ineffective latch, jaundice, illness or infection, neurological disorders, preterm, and small for gestational age. Hypoglycemic newborn. The next breastfeeding challenge that we are faced with is neonatal hypoglycemia. Neonatal hypoglycemia is a blood glucose concentration that is less than adequate to support neurological, organ, and tissue function. It's normal for your baby's blood sugar levels to go down in the first few hours after birth because your baby is separated from the supply of glucose he was receiving from the placenta. Once the infant's umbilical cord has been clamped, the infant relies on breastfeeding, especially colostrum, to normalize blood sugar. Risk factors. Neonatal risk factors for hypoglycemia are prematurity, large for gestational age, small for gestational age, asphyxiated or have other physiological stress, infection, hypothermia, congenital malformations, polycythemia, delayed first feeding, and inadequate production of glucose in newborn. Maternal risk factors for infant hypoglycemia are maternal diabetes, gestational hypertension, tocolytic therapies, maternal weight gain, lack of maternal intake, smoking, and gravida. I hope you all have a good pathophysiology understanding of this breastfeeding challenge and potential causes of both the breastfeeding challenge and the infant condition. As you can see, there are various factors that may affect the effectiveness of infant feeding. I am now going to discuss with you the typical signs and symptoms and any assessment data that comes along with decreased milk supply in a hypoglycemic newborn. Decreased milk supply cues. The 2 most important signs and symptoms of low milk supply in the infant are low weight gain and low output. It is our job as healthcare professionals in perinatal nursing to assess the newborn for adequate intake and output, ultimately resulting in weight gain. Assessing adequate intake and output. Assessing the newborn has adequate intake and output. Baby looks healthy and happy and does not appear to be tired. Baby is active. Breastfeeding 8 or more times in a 24-hour period, approximately every 3 hours. The infant should start gaining weight by day 5. The infant should return to birth weight by day 10 to 14. The infant should be gaining approximately 1 ounce daily for the first 3 months. And by day 5, the baby should have 3 to 5 wet, clear pale yellow diapers, 3 to 4 transitional stools changing to loose yellow. If the infant is having less than this, it shows baby is not having adequate enough intake, resulting in low output, which may be a result of decreased milk supply. Hypoglycemic cues. Infant signs and symptoms of hypoglycemia are jitterness, irritability, lethargy, poor feeding, abnormal vital signs, temperature instability, respiratory distress, apnea, diaphoresis, and seizures. Assessing glucose level. It is crucial for nurses to monitor the newborn's blood glucose level who is hypoglycemic. Monitoring blood sugars is a delicate balancing act. If an infant has hypoglycemia risk factors but does not show any signs of low blood sugar, he will be given a test around 2 hours of age via heel poke. After the initial blood glucose check, babe is then checked every 3 to 6 hours before feeds. The recommendation is to treat a baby with one blood glucose test of less than 1.8 millimoles per liter or for several readings of a level less than 2.6 millimoles per liter. Judgment. Through the research that I've done, it is clear that most often low milk supply is caused by poor feeding and not production of milk supply. Low breast milk supply and hypoglycemic infant have a reciprocal relationship. Low milk supply can cause hypoglycemia, and a hypoglycemic baby can further decrease milk supply. If the infant does not take to the breast well, the milk supply will decrease, which can impact the breastfeeding experience. I cannot stress this enough. Decreased time and stimulation at the breast will decrease the demand, which results in decreased milk supply. Consultation. Spousal and partner support and even siblings of the infant is crucial. A lactation consultant, healthcare professionals specializing in galactagogue supplement, and in severe cases, an endocrinologist who can monitor infants' glucose status. The 3 main priorities. After going through this framework, I have concluded 3 priorities for this challenge in clinical care. As health care providers, we have to help and teach the mother how to achieve and maintain good milk supply, achieve and maintain proper blood glucose level in infants, and monitor adequate hydration and output and weight gain that is appropriate for infants' gestational age. Support and treatment. Nursing support and treatment for the mother who has decreased milk supply includes increasing frequency and durations of feeding, feed on demand instead of scheduled feedings, feed the infant in quiet alert state, improve the infant's latch, start skin to skin as early as possible, stimulate infant to keep them awake during a feed, encourage the mother to do breast compressions during breastfeeding, offer both breasts to the infants during feedings, pumping sessions between nursing to stimulate more milk production, do not offer infant supplements or juices, do not use pacifiers or bottles until breastfeeding is well established. Support and treatment. Nursing support and treatment for hypoglycemic infants. Always remember the 3 E's for breastfeeding. Feed the infant early and often, achieve effective feeding, and exclusively breastfeed. Keep the infant skin to skin as this keeps the baby warm and lowers the risk of hypoglycemia. Do not supplement unless suckling at the breast is not achieving proper blood glucose level. If the blood glucose level is not achieved at the breast, use a cup, syringe, finger, bottle, or sometimes NG tube with express breast milk. Extreme cases of hypoglycemia, and often rare, are the treatment of IV of dextrose. Evaluation. Evaluation of low milk supply and hypoglycemia is based on the infant's health status. Mothers can monitor infant status by amount of wet and dirty diapers in a 24-hour period timeline, appropriate weight gain, appropriate number of feeds per 24-hour timeline, audible swallowing while breastfeeding, and the baby appears healthy, happy, and active. Early, effective, and exclusive breastfeeding is crucial in achieving and maintaining proper milk supply, achieving and maintaining proper glucose level, and aids in overall health status of the infant, which includes adequate intake and output and proper weight gain for gestational age. Applying the situated clinical decision-making framework can help all healthcare professionals better understand health challenges faced by patients and clients. In this case, we are talking about breastfeeding, and the clients are mothers and infants. Through using the framework described, individuals are challenged to critically think. It is important to use interdisciplinary teamwork when making assessments and treatment decisions regarding health issues. As we know, healthcare professionals can impact a patient both positively and negatively, so it is the job of healthcare professionals to listen and be cognizant of both mother and baby's needs. Through using this framework, including the understanding, assessments, priorities, and treatment, I hope that I was able to help you better understand the challenges of low milk supply and neonatal hypoglycemia. Thank you all so much for listening.